Thank you, 一切。
感谢一切的表演。
Next up, we have Mr. Leonard McCully. He was diagnosed with myeloma in 2011, and he's a patient of Associate Prof Cheng at NUHS.
接下来我们有请 Leonard McCully 先生，他于2011年诊断患上多发性骨髓瘤，他来自国大医院，是 Prof Cheng 的病人。
He has undergone several series of treatment as well as an autologous stem cell transplant. He will be sharing with us his personal experience, in particular his transplant journey.
他已经接受过一系列的治疗，其中也包括了自体干细胞移植。接下来他将会为我们分享他的个人经历。
Maybe we'll get to hear a song too.
哦，也许McCully先生也为我们唱一支歌哦。
Since my myeloma, I've reduced height by about 3 centimeters, so drop this a little bit. Okay, I was a lot taller. I looked down on women. Now the women look up at me. Look down. Before I start, just to add to what Prof Cheng said just now, my sister Sylvia, whom you may know of as a ballet teacher, and every other year or so she'll put on a show at Christmas for the kids to perform. She has about 800 students, so about 300 might be performing. And she wanted to raise funds for cancer research. So I said, no, you can't just do that like that. It's got to be myeloma cancer research. So she has agreed to make that a beneficiary, but it's still very early days. We need to discuss a lot of the logistics that go with it, but it's due to be held towards the end of the year. And my thrust in it all is so that we can put myeloma up to the forefront of cancers and get a little bit more funding for the research that could go with it and maybe help me as well along the way. So as we go by, I think you might hear more and more of this if we can come to some agreement on fundraising and getting important people to support this project. Anyway, I'm not here to talk about that. I thought I'd just describe my journey with myeloma and something about myself. First of all, as most people know me, I'm known as Leonard McCully. And I used to be a pilot at Singapore Airlines. So this is my usual pose at the back of the cockpit supervising my students. So they all say, you look very fierce, but I'm not. And these are a couple of the steeds I used to fly in. I finished off on the 777, that's the one on the left.
Wow.
And this is the other part of my life. And this is a build-up because I'm a very active person. I do not like to sit around doing nothing. I'm watching the time because I promised you sit no more than 10 minutes. And I love riding motorcycles, and this is one of my favorites, which unfortunately, being Italian, is very panicky, and I had to sell it off very quickly. So I ended up with a good old Japanese motorcycle, which I used to ride very regularly up at Sepang and Pasir Gudang and so on. I had one form, that's all, nothing serious. And my wife just ignores it.
Oh.
And this is the other 2 wheels, which is another story by itself because after my stem cell transplant, 1 year, 4 months, 12 days, I did the OCBC ride of 42 kilometers, and part of the ride included climbing up Benjamin Sheares Bridge, which, let me tell you, on a bicycle is a very formidable task. And there were lots of casualties along the way, and I saw one guy about 30 years younger than me lying flat on the floor, and the ambulance coming down to pick him up, and I said, no, I'm not going to end up like him. But anyway, this year we're going to ride this one. It's a slightly better bicycle. But that's not my story. In 2011, I was finally diagnosed with multiple myeloma. It was a result of going out on a motorcycle ride and my back giving a huge pop, which was a fracture of one of my vertebrae. And so we went and fixed the back, and we very serious surgery on the back, and I got several vertebrae which are fused, and as a result got shortened. But nobody could understand why the fractures were taking place until, quite by coincidence, a nuclear medicine doctor at General Hospital suspected something was wrong when he was treating me for a thyroid cancer I also had. And he said, I think you better see Darryl Tan, who is a hematologist, and sure enough, it turned out to be multiple myeloma. So I went on the usual Velcade, Revlimid regime over 7 cycles, and I think I had 2 additional ones, which didn't seem to work out. And I was, by that time, 67, and well past the 65 cutoff for a stem cell transplant. But fortunately, because of my active life, and I played lots of squash, I ride motorcycles, nothing keeps me quiet. So I was relatively fit. So I like the way Darryl Tan and Prof. Chen said, chronologically you may be post-65, but physiologically you are probably younger than 65. So we go ahead and do a stem cell transplant. It was one of those good news, bad news days, you know. So I'm very grateful for that, and Prof. Chen was excellent because he said, let's go. And we sort of said, okay, next week. So we did it. And of course, there's some preparation required, and I was admitted to NUH, Ward 8, right, Prof? Yep. Yep, Ward 8, where all the girls are excellent.
Oh, yeah.
Really, really excellent. And they looked after me very well. And so I was there for a period of time doing the initial bit of chemotherapy to extract the stem cells. It's somewhat daunting, and this is where some of the language used by the medical staff is a little off-putting. For instance, we're going to shove a line into your arm. What? Shove a line? I said, you can't do that. I said, no, it's just no pain. I said, you sure? What they were talking about was a PICC line which goes into your arm, and they can deliver all the drugs and take the blood. You know, nothing more off-putting than 6:30 in the morning and they come to you and this ghostly figure appears and says, good morning, come and take blood, huh? And then poke you in the arm. But with the PICC line, it's less daunting and no pain, absolutely painless. Now, for those of you who haven't yet had this done to you, don't be afraid. The language they use is very frightening, but it's absolutely painless. No pain whatsoever. Went down, they take you down to the radiology lab, and they give you a local anesthetic, and before you can say jack, within 15 minutes it's over and you're back in the ward, and you've got this line sticking out in your arm. And it really looks worse than it is. The only snag is with this PICC line, it's a real hassle having a bath. Real hassle because somebody's got to come, cover it up, tape it all up to make it waterproof and so on. And I know when you go into the bathroom, you got to make sure you don't wet it. Now, even before this, I had some other types of lines, and it looks like this. Oh, sorry. These are my 4 grandchildren who provided the motivation to keep going, you know. And there are 4 of them, and they're a lot older now than when this photograph was taken. You'll see it later. But this is some of the plumbing that goes into your arm during the first phase of stem cell extraction. Again, it looks more painful than it really is. It is actually painless, except that when you go and have a shower, you're going to drag the machines in with you, and it's quite funny actually, because quite often you get strung up in the spaghetti, you know, all around you. And these are you'll notice I had about 4 bags going in at one time. And the bags which are in black are the chemotherapy drugs. And I'm told that it's because these are the dangerous stuff, you know, so they're going to put it in black to make sure people understand you handle it with care. But again, totally painless. The only discomfort is that It's there pumping day and night, and you have to learn to sleep in one position on your back with your arm out. And I can do it today, no problem, in my sleep. Okay. Then this, unfortunately, is a side effect. You lose your hair. And you can see, after I had a haircut, it's a lot neater. I lost all my hair except for the eyebrows. They never fell off. So anyway, you go in for your initial chemotherapy, you wait for the Dr. Tan Lip Kun to say, okay, stem cells coming now. Off you go to the blood donation center where there are a couple of nice girls who look after you, and you lie there and you've got to squeeze this little stress ball, blood taken out of one arm through the machine, it comes back into the other arm. Again, no pain. Please, there's no pain, because when you look at the big needle, you say, oh my God, that's a large one. And she said, no problem, local anesthetic, no pain. So it lasts about 4 hours, and here's where it can be a little disappointing, because after the first day I went back to the room and they say, we need to take 10 million stem cells out of you. And that night, 10:30, they told me, we only got 8. So they said, what does that mean? I said, well, tomorrow you do it again. I said, yeah. I said, okay. Because for 4 hours you lie down, you can't go to the bathroom, you can't bend your arm, you can't do much except watch television and talk to the girls, and every 5 minutes they're recording things. So that's the unpleasant part of it. But anyway, the next day I went down and the girls said, we got to take some more stem cells out of you. So I said, 8 million yesterday, 10 million in 4 hours, so 2 million more to go, so 1 hour. So how long am I going to be here? Another 4 hours, they said. And this time, I don't know how they did it, but they got 9 million now. So I've got lots of stem cells, and Prof. Cheng is hanging on to a few more, sitting in a cryogenic chamber. But anyway, the point is they extract it from you, they've got it, and then you go back. And then this is where the second part of chemotherapy takes place prior to the autologous stem cell transplant. And this is a little bit more debilitating. It gets a bit tiring, gets a bit unpleasant sometimes, because you start getting, they hit you with melphalan. Melphalan is a fairly toxic drug. And you lose your appetite, you get nausea, you get a little bit of nausea. I was very fortunate, I didn't get too much nausea, but I had a bad loss of appetite, so I lost a lot of weight. And this is where my caregiver, my dear wife, sat on me and said, you shall take your food. And it was quite tough to eat the food. And this is where you just have to force yourself, because without the food and sustenance, you are likely to get very, very weak. And then all this nonsense about being, better and stronger and so on and so forth, you'll go downhill very fast. And I did lose eventually, I lost 20 kilos, which is a lot of weight. I was 84 kilos and I ended up at 64 at the end of it all. But never mind. There was only one really, really bad day where I had a fever, and that got everybody's attention, because this is where your ability to fight infection and so on is at its lowest point, and you cannot have visitors. And Gina, my wife, used to stand at the door and shoo everybody away and say, no, you can wave to him through the glass and that's it, off you go. And you must wear a mask and so on. So after about a couple of weeks, they said, okay, you're ready for the infusion of the stem cells, and this time we'll take you down and we'll shove a line in your neck. I said, what? Another shoving of lines? Yeah, but it's gonna hurt. No, it doesn't hurt. You sure? So I went down, and sure enough, no pain again. And this time they put a line into your jugular on the right side of your neck. And there are 3 little, I don't know what they call them, the little heads there, through which they put the stem cells through. And it was hanging over my ear, because for 3 days. And anyway, when they were ready, they introduced the stem cells, which was an absolutely painless non-event. one technician to warm up the stem cells, one doctor to see that everybody is not doing the wrong things, and one nurse doing all the hard work. She's the only one busy, the rest is just standing around. Anyway, a strange phenomenon with this transplant is when they introduce the stem cells, suddenly your breath emits a very strange smell which permeates the whole room, and you get a little embarrassed, where's this bad breath coming from? But it's normal, it lasts for a few minutes, and that's it. And it's strange, it fills the whole room. And then after it's gone. And you feel a hot flush. So guys, you experience it. And you know what it means, a hot flush. And it's quite a nice sensation. I think it's very nice. I don't know why the girls complain, but I like it. Anyway, then you stay in hospital for a few more days. And I remember it was 3 weeks at the beginning, a couple of weeks in the middle, when I went home and I lost all my hair. And then another 3 weeks in the hospital, and I know the girls on Ward 8 made a grand announcement that today is your new birthday, the day your stem cells go in, December 16th, 2011. So that's your new birthday, celebrate it, etc., etc. Then I was told you have to hang in there until you can go home, and I went home on New Year's Eve, I think. Prof Chen said, okay, we'll release you, New Year's Eve, you go home. But then I was told, you need 100 days of isolation and be good, no going out, can't go to the wet market. If you're going out to the malls, please wear a mask and try not to go and see crowds, because your immunity is very, very low, and it's not a good idea to get a cold and so on. And ladies and gentlemen, let me tell you, this haze at the moment has given me a bit of a cough, and it took me 3 weeks to shake it off, because I still haven't regained my full, not immunity, but the ability to fight infections over the couple of years. But anyway, I was told 100 days, so I put a bottle of champagne in the fridge, and I said on the 100th day I shall open it and I drank it with my family. Right? Great time. Then got back on the motorcycle. This is my new acquisition. I bought this motorcycle and I parked it in Chiang Mai, and I fly up to Chiang Mai and I ride this bike. The reason why I do this and tell you about it is because you must have something to aim for. If you have nothing to aim for, nothing to live for, then this battle becomes very, very difficult. So you must have something to aim for. And that's me again in Chiang Mai. This is when I rode into Laos. So we rode our bike across the Mekong River into Laos, spent 4 days, 2,000 kilometers. The left side is at the Chinese border, on the border with Yunnan. And if you look at the right, isn't that beautiful? Because you're up in the mountains at 2,000 or 1,500 meters. And we rode through all that sort of territory. It was great. And it's something to do. And I would recommend that every one of us who has to fight this cancer have something to motivate. But it's not only the motorcycles. Oh, sorry, I must show this one though. Girls, I seem to still attract girls despite my lack of height. These two girls were the daughters of the owner of the gas station in Laos. And I said, fill the bike up. How much? 200,000 kip. The Laotian currency is a kip, KIP. Like 200,000 kip for about 10 liters or 20 liters. And this is my last trip 3 weeks ago. It was actually very funny. I'm laughing that I'm not hurt and more embarrassed than anything else. We rode through some very deep sand in some forest reserve, and I had to jump off the bike and put the bike down, and so it looks very funny. But these are the four who keep me going. The eldest on the left, the youngest on the right. And the pretty one is Portia. She's 11 this month. And I said, Portia, when you're 18, you're going to walk down Orchard Road with hanging on to Grandpa's arm and making all the other old men absolutely jealous. So I expect her to be performing in the concert as well at the end of this year. She does ballet as well. But most of all, my greatest caregiver and love of my life, my wife. If not for her support and amazing support, she was in the hospital every day. And because parking charges are so high, she took the MRT. Every day she would walk out, catch the bus, catch the MRT, come and sit with me in the morning from about 9:30, 10, right through to 8 at night. She'd have her meals here and then go back. And then she'd say, don't come, there's no need for you to come. It's a long, hard grind. No, she had to be there. And in the second half of the transplant regime, it was absolutely necessary for her to be there because I was losing the will to eat the food that was necessary to keep me going. So your caregiver is vital, very important, and that person actually works as hard as you do in beating this cancer. So folks, that's my story. There's nothing to fear. There's nothing to fear with the transplant. And don't let these doctors' terms frighten you. It's all part of the show. Thank you.
Thank you, Mr. McCully, for sharing with us your inspiring journey.
感谢麦卡利先生为我们带来的分享，让我们深受鼓舞。
Mr. McCully's active lifestyle, even after diagnosis, is in line with what our physiotherapists shared in our forum last year. We hope to encourage our patients to maintain an appropriate level of exercise.
参加过上一届论坛的朋友，想必还记得当时我们请来的物理治疗师为我们分享到，病人即便生病，也需要在专业指导下进行适度的运动。麦卡利先生的分享也为我们验证了这一点。我们希望借此鼓励我们的病人维持适度的身体运动。
Before we invite our next speaker, we wish to invite a pair of twins up to present us a contemporary dance.
接下来，我们有请一对双胞胎姐妹上台来。